There is nothing more we can do. That's what a doctor said to a patient from India. It is the most devastating sentence in the human language. For many international patients battling stage 3 or 4 cancer, these 8 words are the final verdict from their local oncology team. You have done the surgery, you have finished the chemotherapy, you have undergone radiation, and now you are told that the standard of care has been exhausted. But in 2026, the standard of care is not a global constant. What is considered the end of the road in one country is often just the beginning of a new clinical pathway in the United States. Hi, this is Dr. Priyanka Mathur, founder and CEO of MediPocket USA. We are a global medical concierge connecting international patients to the world best US experts for second opinion, centers of excellence for treatment, and clinical trial programs. And today we are going to peel back the curtain on why US oncologists find life saving options in cases that were labeled hopeless elsewhere. Now, we are talking about the gap between local limitations and global breakthroughs. Why is there such a massive difference in treatment options? Now, it isn't necessarily because your local doctors aren't skilled, it's because of the systemic gap. In many countries, oncology is still practicing organ based medicine. If you have lung cancer, you get the standard lung cancer protocol. But in the top tier US cancer centers like Mayo Clinic or MD Anderson, they practice biomarker driven medicine. They don't treat the organ, they treat the driver of the disease. International patients face three primary hurdles. Now, one is the diagnostic ceiling. Many regional labs only test for 3 or 4 common genetic mutations. If you don't have those, you are told you are standard, which limits your drug options. Second is the regulatory delay. Life-saving drugs approved by the FDA in 2025 or 2026 might take 5 to 7 years to reach pharmacies in Saudi Arabia, India, or Singapore. The third is the volume paradox. Now, a local doctor might see 10 cases of your specific cancer a year. A US subspecialist in a molecular tumor board sees 500. They recognize patterns that others simply haven't seen enough of to identify. Now, when a US oncologist receives a case from MediPocket USA, they don't just read the summary, they relitigate the entire case. Often they find that the stage 4 incurable label was based on incomplete data. We have seen cases where a patient was told their tumor was inoperable. A US surgical oncologist reviews the imaging and identifies that with a specific neoadjuvant pre-surgery immunotherapy that the tumor can be shrunk away from vital organs, making it suddenly miraculously operable. Or they look at the pathology slides and realize the cancer was misclassified. A standard adenocarcinoma might actually be a rare NTRK fusion positive tumor. Why does that matter? Because there is a specific pill for that. A pill that doesn't just manage the cancer but can melt it away with far fewer side effects than chemotherapy. If you're watching this because you or someone you love has been told there are no more options, I want you to listen closely. That no is based on the tools available in your current zip code, not the tools available to the world. At MediPocket USA, our mission is to ensure that geography never dictates your destiny. Click on the link at the description and book a slot with our USA advisor to know your treatment options now. Our physician-led team acts as your clinical bridge. We don't just refer you, we harmonize your records, prepare your case for US standards, and put you in front of the exact specialist who can change your narrative. Don't wait for the symptoms to worsen. Click the link in your description or the sign up button below to start your private case review in the MediPocket today. Your second opinion is your second chance. Let's talk about the secret sauce of US oncology, the molecular tumor board. When you get a remote second opinion through MediPocket, your case often goes before a multidisciplinary team. This isn't just one doctor's opinion, it's a symphony of expertise. It includes the molecular pathologist who looks at the DNA of your tumor, the interventional radiologist who looks at the advanced imaging techniques like PSMA, PT scan, PET scan that might show the cancer is less spread than previously thought. The research scientist who knows about a phase 2 clinical trial opening next month that perfectly matches your genetic profile. In 2026, we are seeing the rise of tumor agnostic therapies. These are drugs that work on any cancer, anywhere in the body, as long as specific genetic key is found. International labs often don't even look for these keys. US oncologists start by looking for them. This is how terminal becomes chronic and chronic becomes remission. You might be thinking, how do I even get my messy records to these doctors? That is where medical concierge model changes everything. We have built a proprietary system called Doc AI MediPocket. It's a HIPAA secure digital fortress. Now you upload your records, your imaging, and your pathology. Our AI-driven engine, along with the physician, clinically harmonizes the data. It translates the medical jargon, organizes the timeline, and presents a US standard brief to the specialist. Because we are a physician led, we speak the language of the US hospitals. We don't ask for an oncologist, we ask for the director of the sarcoma program at Cleveland Clinic. We cut through the red tape so that your case reaches in the desk of the person who actually has the power to say yes when everyone else said no. Medicine is moving faster than the world can keep up with. In 2026, we have mRNA vaccines for melanoma in trials, CRISPR edited cell fighting leukemia, and targeted therapies for stage 4 cases that were unthinkable just 24 months ago. If your local team has run out of options, it doesn't mean the world has. It just means you need to broaden your horizon. At MediPocket USA, we believe that every patient deserves the US advantage. We believe in the borderless world where the best care finds the people who need it most. Don't accept no until you have heard what the world's leading experts have to say. Visit our website, explore our case studies, and let us help you find the door that was hidden in plain sight. Thank you for watching. If this video helped you or could help someone you know, please like, subscribe, and share it. Information is power, and for a cancer patient, it's life. I'm Dr. Priyanka Mathur, and we'll see you in the next Pulse.